Are you suffering from knee arthritis?
Well, if you are, you're in luck because we are going to go through 14 different options what do we, help me out, Mike.
We're going to go through 14 different tips to help keep your knee arthritis at bay. Some of them are strengthening, some of them are stretches, and some of them are things to avoid.
Right, and Bob actually did a pseudoscientific study on 1,410 different patients that we've had seen typically on an average of 1 year. So we've got a lot of information from real clinical experience.
But I like round numbers, so we're saying 1,500.
There you go. All right, I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
Even though we ramble a little bit, let's get on with the program.
What's as we? This is you. Anyway, so we're going to go through 14 different tips for knee arthritis people. We're going to start with the least important and go to the most important.
All right, let's go with the first two large muscle groups, the hamstrings and the quadriceps. Now, if you're working your hamstrings, you're doing a good thing with strengthening those, but it does put undue stress on the joint itself. So we're going to stay away from exercises like this, isolating the hamstrings, or what we call long arc quads or kicks. I have some weight on there. Those two we could probably back off on or not do.
Now, most people would probably do these at a gym on machines, and those can really flare up the knee joint itself. So try to avoid those for a while. If they seem to not be problematic for you, you use bands or cuff weights like that, they seem fine, then you can do them, but it's just something to keep in mind. The next tip is sitting like we are right now and letting your knees and legs kind of decompress. We kind of call this tailgate sitting because you're sitting on the end of a truck tailgate and you're just letting gravity kind of pull and distract and get some motion in your legs.
That's
you can
right.
do some little kicks even if you want.
I've literally had people who've had trucks sit on their tailgate and do it. Oftentimes they're farmers, they feel very comfortable with it, and it was a great functional therapy for them.
The next tip, number 4, is to massage a muscle called the popliteus. Brad is showing it's right behind your knee, and it typically helps with minor rotation within the tibia and the femur there when you're walking. If it's tight, it can be problematic. Normally, you'll notice because your knee pain is behind your knee itself, and it'll be tender when you palpate it. So you can just take your hands and dig in there and massage. If you happen to have a massage gun, you can certainly use a massage gun to massage in there as well. Whatever works best for you and is convenient.
Yeah, it's easy to do. And like I said, it helps particularly when you wait very initially on that leg, getting the mechanics of the knee to line up properly.
Now, tip number 5 is strengthening your core. Now, this only pertains to certain people that have a weak core. What can happen if you are weak enough, you may see some people, is they have kind of a Trendelenburg or waddle gait like Brad is showing. Your core is not just your abdominal muscles, it's also a different muscle groups of your hip muscles as well. So doing some type of core strengthening exercises can help because if you have a waddle walk, you're going to be putting more impact forces on your knees, which can flare up your arthritis.
You're kind of babbling too.
I learned from you.
Actually, it was a really good discussion and an explanation. The next one is strength of your toes, and what that does, if you can curl your toes strongly, it helps maintain arch. If your arch collapses, watch what happens when my arch collapses. My knee actually internally rotates and goes medial or inside. It throws off the mechanics of the knee and it can make arthritis worse.
So toe flexion of our big toe is curling your toe. In order to do this, you can try to do towel scrunches on the floor. I have a sock on and a towel, so I'm not going to be able to grip too much. If you were barefoot, you could grip more. Essentially, you just want to try to grab the towel with your toe and curl it under. If you happen to have some dice at home, this one's a little small, so it's kind of hard, but you can try to pick it up with your toes like that. That will work on your toe flexion as well. Strengthen up that arch.
Yeah, it makes it a little fun. And, if you got cute socks like his, they're kind of cute little toey things there. That's pretty cool.
I saw a patient with dog socks yesterday, and they even had ears.
See, it all comes into play, doesn't it? Now, what about this next one? Drink more water. This is something that most people can do because most people do not drink enough water, actually.
No.
Especially as we age.
Just making sure you're staying hydrated can impact arthritis all throughout your body. So it's important to drink your water. Next one is using some type of massage around the muscles of your knee. Now, if you have knee arthritis, you cannot massage your knee joint. It would hurt a lot if you were to run that right on your knee joint. So if you want to massage the areas around it, so we can do the quad regions up here, or you can do down below and get your calves as well, because if you have tight calves, it can affect your knees as well, or maybe even the hamstrings.
And I'm really going to emphasize, you'll want to have the air head like I have here. It's actually full of air. It is soft. So when you do get close to the bones, which your knee does have enough exposure to bones, that is one area where my air head really helps out. So you can work close. If you do hit the kneecap or the medial epicondyle, it does not hurt. You just get off there and get back on the muscle. And again, we're working that popliteus like we did before, as well as the other muscles. So they can be a nice tool if you have one. If you want to get one, it can work out well as well.
Next thing to check out is making sure you have good motion or rotation within your hip joint, because your hip joint can directly affect your knee joint as well as your back. But we're talking about knee arthritis, so make sure you have good internal, external rotation. To show this, you can just try sitting and let your leg fall out to the side. If you're tight, you're going to be more up here, so you're going to want to work on stretching that and rotating the other way as well. It's a little harder to do in a seated position, but you can just simply sit at the edge of something taller like this, see how much movement you have between sides. Maybe I have knee arthritis on this side and I have limited motion. Then you're going to want to look up some type of hip stretches that you can do.
Right. The other thing that if you're standing, like in the olden days when smoking was a lot more popular, you put the cigarette butt down and with your forefoot and then you squash out that cigarette. If you're in your 60s, you definitely remember watching people do this, because there was a lot of smoking going on back in the 60s and 70s. But look what it does to my hip. It rotates it, and you're using some of the muscles. So you're actually doing a little bit of strengthening, getting that range of motion. And you'll notice, do one leg and do the other leg. And it's also good for the hip as well.
Now, the next thing we want to, I was going to say, fun fact, in 89, they're still smoking in airplanes. That's when they just banished it.
In 1989?
That's what I heard
Wow,
the other day.
I didn't realize that.
No one fact-checked me. I swear it's the right date.
All right.
Anyway, the next thing we do is want to stretch your hip flexor muscles. If they can become tight, they can directly affect your knee. We actually have one muscle called the rectus femoris, which flexes your hip and extends your knee. So if that one's tight, it can be very problematic. To do this, most people, if they're having knee arthritis, don't want to get down and kneel to stretch. So you can lay on the edge of a firm surface. If your bed is firm enough, you can try that. You're going to start with both knees to your chest like this. If I'm stretching this one, I'm going to drop it off the edge. Now, to get the rectus femoris muscle, I'm actually going to flex my knee as far as I comfortably can, pull the opposite knee towards my chest. We're going to hold this for about 30 seconds and perform it on each side. Don't let your leg drift too far out, because I'm not feeling much of a stretch now.
Yeah, so that rectus femoris muscle actually goes from your pelvis all the way down to your kneecap, and that's why this motion here is going to get that muscle that usually does not get stretched. If you don't feel comfortable lying down on your bed, or if you don't have a plinth at home, you can use a chair like this. A nice firm chair with armrests is probably best. Turn sideways so just one butt cheek is on the chair, and then go down like this. And I like to do this. I just kind of rock it backwards like this. Hand here and stretch back. And that's a nice way to get to those hip flexor stretching.
Now, the next thing we want to talk about is strengthening your hip abductors. We're at number 11 now. We're getting there.
Yeah, moving along.
So your hip abductors keep you upright when you are standing and walking. If they're weak, kind of that waddle walk we talked about earlier can become present, and that can affect your knees. If you have weak muscles here, it also can impact your knees, make them cave in more. So what we want to do is you can just simply walk sideways. If you are feeling uncomfortable or unsteady, you can use a countertop or cane when doing this. If you think, hey, this is way too easy for me, you want to add some resistance. If you have any type of loop band, even cuff weights, whatever you have, I just put it around my knees, make my legs stay out as I'm stepping sideways. This is a good hip abductor strengthening exercise. Brad, are you going to show a standing version?
Yeah. So you're putting on the cuff weight. Now, I've actually had people, so they didn't have to purchase a cuff weight because you don't need a lot of weight, is if they happen to live in, like Minnesota or Wisconsin, they got winter boots that weigh a couple pounds, and then you're going to work it like this. Good control. Do not point the toe out. You're going to put it straight in front of you, and good control. You're not letting it bump, and we're certainly not doing this. So up, good posture, 10 to 12 of these, up to 15 if you want, and do both legs.
Tip number 12, we're getting to the more important numbers here.
That would be a dozen.
Thank you for telling me what that is. You should not walk with your knees locked out. So what we mean by this is when you're walking and stepping, your leg goes out in front of you a ways, your heel striking, my knee is completely straight. This is going to put a lot of impact forces on the knee joint itself, which is already inflamed from your arthritis. So what we want to do is land with a nice soft bent knee like this. See how my knee joint is bent. Now my muscles are taking the shock absorption versus my joint. In order to do this, go in your house, go barefoot or in slippers, and just walk around. Naturally, you're not going to like heel striking, walking barefoot or with minimalist shoes because it doesn't feel very good. So just walk with a nice soft bent knee. You're going to take shorter steps to begin with. Over time, it'll start to feel more natural.
Yeah, we've had success with these with people with arthritis. As soon as they start doing that 4-foot bent knee, and it hurt when they were going heel strike as often as they usually have, this immediately is like, oh, wow, that does feel better. Put a little smile on their face. It does take a little time to get used to that, though. So be patient. It's probably not going to happen in 1 or 2 days getting used to it. So what, are we on 13?
We're on tip number 13.
You know what that is?
Unlucky.
No, baker's dozen.
Oh, I was going to say Jason from Friday the 13th. Anyway, the next one is walking with a walking stick or cane if you're having a flare-up. Now, we're not saying you have to use it forever. However, if you're having a lot of knee pain, using a cane or walking stick can take a lot of load off of your joint itself. So if my left knee is bothering me, you're actually going to want to use it on the opposite side. This cane's a little tall for me, so get it set up right for you first. But just simply having that pressure going off of your knee joint into the cane can help. You don't need to use it forever as long as your pain does go away in time.
Yeah, walking sticks are nice as well. You just do it properly. The opposite leg goes with the stick, and it also gives you a little more upper body motion and strengthening, so it's a win-win situation.
If you're at a point where you need a walker, that's perfectly fine as well. It's just that most people don't want to do that initial process of going to a cane because they don't want to be seen with it.
Yeah.
It can't happen.
Just try it. If it makes your knee feel better, you can walk without pain, you'll want to use one.
Now, the most important thing you want to do is actually strengthen your glutes, and we're going to be talking about the glute max now. We already talked about the hip abductors, the glute medius muscles. So when you are walking, like we talked about with a 4-foot walking, your muscles are going to engage more, and the most important one is your glute max when you're actually pushing your leg back like this. Your butt muscle can handle a lot of walking. Your joints can't handle as much. So to try this out initially in your house, walk with your hands on your buttock how you normally would without soft knee bending, and then try going up on your tippy toes. You should feel your glute max engaged a lot more. That's important. Some people, if it's not firing properly, want to try this exercise.
Right. Firing yeah, in other words, those muscles you can feel
aren't engaging properly.
Yes, we must use proper terminology. Now, if you want to go up to a countertop like this for balance, you're going to take for that right glute max, you're going to bend this knee about 90 degrees. That's here, not up here, not down there, right in the middle. And we're going to go like this, not like this. We're not kicking the ceiling. It's not a mule kick, but it's at mid-range, good control, and that's going to make that glute max fire. If you want to do this with your foot and rotate it this way, that actually isolates that muscle a little bit more, and I can feel it more just after a few repetitions. So 10 to 15 repetitions, do that 3 times a day, and do it on both legs. Once those muscles start to fire and they really realize what they need to do without thinking about it, all this comes together and it really works out well. So be patient with it. 14, that's a lot of things to think about.
Yes, think of which tips pertain to you specifically. Obviously, they don't don't work for everyone. And if you want to check out another video on how to actually strengthen your knee, you can click the video link on the screen.
There you go. And again, 14, if you can't remember them all, just continue to watch the video over and over and over. Hit like lots of times.
And then comment, who rambles more?
No, they are good tips. They are serious, and some of them will pertain to you and some won't.